Good evening, maybe good morning, sometimes good night, everyone. My name is Jason Roberts. It's a pleasure to be present and hosting this Antimicrobial Optimisation webinar. This is a really exciting webinar. This topic is very focused on paediatric care, and as many of you will know, those that work in paediatrics, this is a horribly understudied area for a group of patients that are very precious to us all, and those that we want to see have only but the best opportunities to succeed with their health. And so this is a really important area. Many of the presenters will tell you about the terrible outcomes and the ongoing persisting high morbidity and mortality rates associated with severe infections in pediatric patients. And so that really does highlight why optimization of the available drugs that we have is so very important. So I would like to acknowledge the sponsors of this event that make these education programs possible. So the University Hospital Nîmes in France, who is an education partner of ours at CRE Reduce, but also Pfizer, MSD, Gilead, and Baxter. One important note that I would like to add is that we take a lot of pleasure in being able to run these educational opportunities. So of recent times, of course, they've had to be in the form of webinars, and we're hoping to return to some in-person meetings in 2022. But the life of CRE Reduce has come to an end, and that's because the specific funding that came from the NHMRC, which is a health and medical research funding body in Australia, has come to an end for that centre. But something which is very pleasing is that a new CRE, which we are fortunate to lead again, has been funded, and that's going to be called CRE Respond. And our focus of this is that although we provide a lot of education through the Centre of Research Excellence activities, we also have a large volume of health and medical research that we undertake. And so through the next iteration of this Centre of Research Excellence called Respond, we are aiming to more strongly implement the findings of our first iteration. So that's something which we're really excited to do over the next 5 years. Of course, with that ongoing support that we have from the NHMRC, that will then allow us to continue to provide educational opportunities like this and others, as I'm sure many of you would have seen over the recent years. This year alone, we've had as many as 10 different educational opportunities. The final comment I'd make is that it is World Antibiotic Awareness Week, which is now commenced, and it is very nice to know that we are an important part of an Australian array of educational opportunities that are ongoing, not only run by our group, and we have a couple of webinars occurring next week, but also by NCAS, so the National Centre for Antimicrobial Stewardship, and other groups such as the Queensland Statewide Antimicrobial Stewardship Service. Details of those can be found on our Centre of Research Excellence Reduce webpage, which of course you would have had to have gone through to register for this. So with that, I'd like to hand over to Dr. Susie Parker, if she is able to turn her camera on. Welcome, Susie. Susie is one of our star researchers here at UQCCR, and she has a very strong research program based at the Queensland Children's Hospital as well, whereby she's looking for innovative methods to ensure that we can deliver optimized dosing to pediatrics and neonates. I'll hand over to Susie and wish our wonderful speakers that I'm really excited that we get to hear from tonight all the best for a wonderful session. But Susie, please.
Thank you, Jason, and welcome everyone. It's lovely that you've joined us this evening. As Jason has said, we've got quite a program running out of the Queensland Children's Hospital where we're looking at antimicrobial optimisation and trying to find the best dose to suit the different patient groups in paediatrics and neonates. So I'm really interested in the speakers tonight. I'm really looking forward to hearing what they have to say, what their experiences are of dosing, and looking forward to finding opportunities to look at collaborating with them in the future as well.